Assalamualaikum. Welcome to our video presentation for Physics Code 380. Our topic is Material Characterization in X-ray Machines. This presentation is specially prepared for Madam Azianti binti Saroni. In this video, we will explain how X-ray machines are used to study and analyze material in a safe and scientific way. Before we begin, let I introduce our group member. We are from class AS1204M, and this presentation was prepared by 3 of us. Each of us worked together to complete this presentation on X-ray machine for material characterization. So, in the next slide, you will see our names, and each group member will introduce themselves. Now, let's move to the next slide to look at the content of our presentation.
Hi, my name is Characterization binti Muhammad Sahabuddin and my student ID is 2023X64658.
Hi and Assalamualaikum. My name is Nur Amni Shamimi binti Arif. My student ID is 2023665024.
Hi, my name is Muhammad Akif Anaki bin Muhammad Farid and my student ID is 2023X03902.
So these are the topic and content we have covered in our presentations. First, introduction. Second, significant diagnosis. Third, instrument and application. Fourth, real-world example. Fifth, potential benefits. Sixth, challenge. Seven, conclusion. And the last one is reference.
What is X-ray machine? X-ray machine is a medical device that uses X-ray radiation to create image of internal tissue and organ for both diagnostic and also therapeutic purpose in medical practice. It consists mainly two parts, which is X-ray generator and also X-ray detector. So what is the meaning of X-ray generator and X-ray detector? X-ray generator is a device in the X-ray machine that produces X-ray, and it's also generally contain X-ray tube, which is most case used in radioisotope to produce an X-ray. So, what is the X-ray detector? X-ray detector is a device that used to measure the spectrum, spatial distribution, flux, and other properties of X-ray. And the patient is placed between the X-ray detector and an X-ray generator to create an image. Here, I will explain for you about 4 types of significant diagnostic of the X-ray machine. First, we have radiography. Radiography is a medical imaging technique that uses X-ray, gamma ray, or other form of radiation to create of internal structure of the body, and the image are used to monitor various medical conditions such as tumors, fractures, and also infection. Okay, so second, we have fluoroscopy. Fluoroscopy is a medical procedure that uses X-ray to show internal organ and other bodily tissues. Fluoroscopies also can create real-time video, and it can be used to inspect an array of the bodily system, including the digestive system and also reproductive system. Okay, third, we have mammography. Mammography are used to examine breast tissue, primarily to detect breast cancer, and it requires much lower dose of X-ray beams than regular radiography, and it's often used to capture image from above and from a side of the breast. And lastly, we have computed tomography, and also known as CF. So what is computed tomography? Computed tomography is a medical imaging technique that uses X-ray to create detailed cross-sectional image of the body. The image allows to see bones, soft tissue, and organ in greater detail than the standard X-ray. So, the tomography also used to diagnose a wide range of medical conditions, including injuries, illness, and tumors.
Now, I will explain the main instrument used in X-ray machine. There are 4 important parts. First is the X-ray tube. It has cathode and anode. The cathode makes electron and the anode is the target. When fast electron hit the metal target, usually tungsten, it will produce X-ray. Second is the high voltage generator. It gives strong voltage to help move electron from the cathode to the anode. This is needed to create the X-ray. Third is protective shielding. This is very important for safety. It includes lead walls, lead apron, and thyroid shields. This help protect patient from worker from too much radiation. Lastly is the image receptor or detector. This part captures the X-ray after they pass through the body. The type used can be film, compute radiography plates, or digital plate panel detectors. All these parts work together to make the X-ray machine work safely and effectively. This slide shows the various applications of X-ray machine in three major areas: medical, industrial, and scientific research. Let's start with the medical field. X-rays are most commonly used for diagnostic imaging, which help doctors see inside the body without surgery. For example, chest X-ray are used to detect lung infection like pneumonia or tuberculosis. Bone X-ray help doctors find fractures or broken bones and check for proper bone alignment after injury. Meanwhile, dental X-ray are important in spotting tooth decay, examining root canal, and understanding the structure of the jaw before surgery or braces. Now let's move on to industrial application. In this area, X-ray machines are used for non-destructive testing. This means inspecting material like metal parts or welded joints without cutting or damaging them. In security screening, such as at airport, X-rays are used to scan luggage and cargo to detect dangerous or illegal items. X-rays are also essential in quality control in electronic and manufacturing. For example, to check for hidden crack or defect inside a product before it's sold. Lastly, in scientific research and analysis, X-ray technology is also very useful. In crystallography, scientists use X-ray to determine the atomic and molecular structure of crystal, which is important in chemistry, biology, and material science. X-ray also used in archaeology and art to examine ancient artifacts or painting. This allows research to study the layer, material, or hidden features inside an object without damaging or destroying it. Let's move to the real-world implement. In X-ray machines, different materials show different results because of their material characteristics. Those means each material can either block or let X-ray pass through, depending on how dense it is. Let's say the doctor used an X-ray to checking a broken bone. Bone is dense material, so it blocks X-ray very well. It appears white on the X-ray image. Skin and muscle are soft material, so they let more X-ray pass on it. Air in lung appears black because it lets X-ray pass easily. So, because of those differences, the doctor can clearly see the shape of the bone. Either it cracked or broken, it will show as a dark line or gap in white bone image.
So, for this slide, I'm going to talk about potential benefit. First, non-dialysis medical diagnostic method used for non-invasive diagnosis, reducing the need for procedure like dialysis. It improves patient comfort and lower health risk. Number two, high resolution and precision imaging. provide sharp, detailed visual, allowing early and accurate detection of disease or abnormalities. Number 3, versatility in application. Useful across many fields such as neurology, oncology, cardiology, making it a cost-effective and flexible diagnostic tool. Lastly, multi-scale analysis. Enable examination from large organ down to cellular structure, giving a complete picture of health condition. So, for this slide, I'm going to talk about challenges. First, safety concern, radiation exposure and compliance. Exposure to radiation in imaging technique like X-ray or CT scan can be harmful if not properly managed. Hospital must follow strict safety regulation requiring protective equipment and trained staff. Second, technical limitation, penetration and resolution. Some imaging tools cannot penetrate deeply into certain tissue or may not capture very fine detail, affecting the accuracy of diagnosis. Lastly, high cost equipment and maintenance. Advanced imaging systems are expensive to purchase, operate, and maintain. These include the cost of machine, software, staff training, and regular service. So here is the conclusion. In conclusion, X-ray technology gives big impact in our world today. This is proven when in medical application, X-ray imaging techniques such as radiography and CT scan. X-ray also have its challenges and benefits. For example, X-ray technology offer high resolution and precision but face challenges such as radiation exposure and high cost. Lastly, in the future, X-ray technology include multimodal imaging system that integrate X-ray with other modalities such as MRI and ultrasound. Overall, for the next generation, this technology can be improved and promising advancement. So, here the reference that we use during researching information to complete this video. That's all from us. Thank you for attention. See you next time.